Hello, how you doing today?
Hello, Miss Nicole.
Dr. Nicole M. Brown. We're teaching all of our future nursing students today. Thank y'all so much for coming out. We're happy to have you. Y'all are ready to be the future nurses, okay? We are so happy to have you. You know, we're going to learn a lot of good things today about different types of nurses. Our topic today is the 15 highest paid nursing careers, okay? And we're going to start with number 1. Nurse anesthetist. That is a nurse who works in the operating room, who puts patients to sleep. Okay? And they bring them back after the surgery. So they are the highest paid nurses of all. And also they're at a advanced practice level. That means they have a master's or a doctorate. Now, number 2 is a general nurse practitioner. Did you have a question?
What is a general nurse practitioner?
A general nurse practitioner is a nurse who can take care of all patients. They can take care of patients in the emergency room, oncology, in clinics, and on med-surg floors, ICUs, anywhere in the hospital or outside the hospital. They have their own practice, okay? Then we have number 3, gerontology nurse practitioner. That's a nurse who is at advanced practice level also, and is specialized in the aging population. So they take care of people who are 65 and above. Then, pain management nurse. Nicola, did you have a question?
What is a pain management nurse?
The pain management nurse focuses on providing pain management to people who are in chronic pain. There are a lot of people out there who can have chronic pain from injuries, car accidents. There are sports players who have chronic pain. Anyone who's worked in, it depends on what type of work that you do, they can suffer from pain. And pain management nurses coordinates all that and helps people with managing their pain. Next, we have number 5, psychiatric nurse practitioner. Another advanced practice nurse. Anytime you see practitioner, that means master's or above. Now, the psychiatric nurse practitioner will focus on patients who have some mental illnesses or who may be suffering from depression, suicidal thoughts, also who's come back from the military with post-traumatic stress disorder, PSTD. So that nurse can step in and help and make sure this person gets the proper medications and the proper resources, okay? Next, we have number 6, nurse midwife. You have a question?
What is a nurse midwife?
Nurse midwife is a nurse who focuses on delivering babies, okay? Then we have number 7, family nurse practitioner. Again, master's level and above, and that's a person who can take care of babies, children, moms, and dads. And they can write prescriptions. Any nurse practitioner who is certified can write prescriptions in the state they're in. And it depends on what state they're in. If they're independent contractors, they can have their own practice. Next, we have number 8, nurse informatics or informatics in nursing. That means a nurse who specializes in computers. Nurses have to have computers to function in a hospital. That means they have to have certain types of computers for documentation. Next, we have the clinical nurse specialist. That means whatever specialty you're in. Now, for me, I function with education and also emergency room. So I can be a clinical nurse specialist for an emergency room. That means I'll be an expert on all the medications, on all of the certifications that nurses need, any types of procedures, such as applying a cast, anywhere from helping patients with their medications. So that's what a clinical nurse specialist. They will specialize in whatever area. If they're in oncology, med-surg, or in ICU, they could be a clinical specialist. So that means they know all the skills on that particular floor. Next, nurse administration. Nurse administration is going to be the person who hires nurses, gives them raises, also functions at meetings at the board for the hospital or whatever organization they work at. And number 11 is going to be nurse educator. And that's what I do. Nurse Nicole is a nurse educator. I go out, I educate children. I'm also educating the world about nursing. I educate moms, dads, little people, older people. Also, we have the nurse dolls, which they're educating the world. Next we have Neonatal Nurse. That's number 12.
What is a neonatal nurse?
Great question, Nicholas. The neonatal nurse is the one who specializes in babies who are born when they're first born. That means they're newborns. So from when they're delivered until they get ready to leave the hospital, a neonatal nurse will take care of that baby. Okay. Then you have number 13, critical care nurse. That's the nurse who works in the ICU. That means that person needs one-on-one care or one nurse to two patient care. And this person may have been in a major car accident, has had open heart surgery, and they need a nurse one-on-one to give that specialized care to just one patient or two patients. Normally, a lot of nurses on the floor may have anywhere from 4 to 6 patients. So that critical care nurse or the ICU nurse, or can it be a mobile MICU nurse, SICU nurse, all of those nursing at the 1 to 2 or 1 to 1 ratio. Then you have number 14, health policy nurse. That's a nurse who works with human resources to develop policies. She also does research for that organization to collaborate data to give the best outcomes for the patients, the nurses, and the community. And then we have number 15, your medical surgical nurse. Nicholas, did you have a question?
What is a medical surgical nurse?
Great question, Nicholas. The medical surgical nurse, this is a specialty on the floor. Like a medical and surgical nurse is the one who will recover patients after they come back from the operating room. And they're released from the operating room. They come back off of their anesthesia. They'll be able to go to a med-surg floor where nurses will take care of them. And there maybe stay a few days where they can start getting back, learning how to maneuver, learning how to eat. Sometimes when you have surgery, you can't eat for a couple of days. So those are the nurses that focus on making sure the patient can eat, walk, go to the bathroom, and those types of things. Well, we really enjoyed you, and we've gone over the 15 highest paid nurses in the country. Okay, and these are some of the things that we've been working on. Nursing is still growing. We have over 200 careers, and these are just the top 15, the highest paid ones. So it's very important. And thank you, future nurses, for coming out. I'm so glad y'all came out. Thank you so much. Y'all have a great night.